them. Hopefully we won't need them. I don't think we'll need anywhere near them. But we'll have them for the future, and we'll also be able to help other countries who are desperate for ventilators. The UK called today, and they wanted to know would it be possible to get 200, and we're going to work it out. We got to work it out. They've been great partners. United Kingdom.
The focus of all political parties should be to save their people. Please don't politicize this virus. It exploits the differences you have at the national level. If you want to be exploited, and if you want to have many more body bags, then you do it. If you don't want many more body bags, then you refrain from politicizing it. No need to use COVID to score political punches. No need. You have many other ways to prove yourselves. This is not the one to use for politics. It's like playing with fire. We're close to every nation. We're colorblind. We're, what do you call it? Wealth blind. We don't see. For us, rich and poor is the same. For us, weak and strong is the same. The United States and China should come together and fight this dangerous enemy. They should come together to fight it. And the rest of G20 should come together to fight it. And the rest of the world should come together to fight it. This virus is dangerous.
They called it wrong. They called it wrong. They missed the call. They could have called it months earlier. They would have known. And they should have known. And they probably did know. So we'll be looking into that very carefully. And we're going to put a hold on money spent to the WHO. We're going to put a very powerful hold on it, and we're going to see. It's a great thing if it works, but when they call every shot wrong, that's no good.
Hey, what's going on, guys? Back again. I just wanted to recalibrate this whole theory of the World Health Organization, faulting on their notification to the rest of the world. Well, I very well possibly do have proof here. We're going to take a look at these stats and basically, what's going on, and to actually kind of maybe possibly come to a conclusion is the World Health Organization, i.e. WHO, are they actually China-centric? So we're going to find out today. Before we get into it, please make sure you drop a subscribe down below, and please share this video and it's in my channel with everyone that you can. This is going to be some interesting information, and again, I'm going to let you use your own thoughts and your own opinions. So here we go. World Health Organization, Middle East Respiratory Syndrome Coronavirus, MERS-CoV. Now, we're going to look at the Republic of Korea, other countries, and Saudi Arabia. The worldwide reduction in MERS cases and deaths since 2016. We're going to go to this other chart here that highlights MERS monthly summary as of November 2019. We've heard a lot of people say that, this virus has actually been out since November. The WHO or Health Organization knew about this virus prior to back in November. Well, this fatality rate for this type of MERS actually was alarming to the World Health Organization based off of its mortality rate, because it had a higher, much higher contagion percentage and a much higher fatality rate than the previous 2012 MERS-CoV virus. So the virus had actually mutated based off of whatever type of science project they were trying to make it stronger. So we're not really going to talk about how it was released, but we're going to talk about timelines and who knows what and who doesn't know what. So here we go. At the end of November 2019, a total of 2,494 laboratory confirmed cases of the Middle East Respiratory Syndrome MERS, including 858 associated deaths. The case fatality rate of 34% were reported globally. The majority of these cases were reported from Saudi Arabia, 2,102 cases, including 780 related deaths, a case fatality rate of 37%. And so then, since September 2012, WHO has been notified of 2,494 laboratory confirmed cases of infection with MERS, coronavirus. So 858 MERS COVID cases associated with deaths have occurred since September 2012. So not a big change there, right? So you see, since 2012 until 2019, there has only been 858 associated deaths, relating to MERS COVID. Since September 2012, 27 countries have reported cases of MERS COVID. So since 2019 now, when we go to look at worldwide reduction in WHO and colleagues, so July 8th, 2019, WHO and colleagues from the University of Oxford, Imperial College London, and Institute Pasteur have estimated that since 2016, 1,465 cases of the Middle East Respiratory Syndrome coronavirus MERS, and between 300 and 500 deaths may have been averted due to accelerated global efforts to detect infections early and reduce transmission. So there may have been a better averted death count due to accelerated global efforts. So again, the World Health Organization, WHO, is already automatically admitting that because of the lack of notification that they gave to the other global countries, it says that due to the averted due to accelerated global efforts to detect infections early and reduce the transmission. So who's obviously going to have these statistics? Who's going to have this information? The only organization is going to be WHO, and WHO is responsible for notifying other countries of this virus. And if other countries are failing to react on these viruses, well, it's going to be because WHO, World Health Organization, failed to notify those countries. Kind of follow the responsibility line There you go. So again, now we know that the United States has funded almost 457 billion, if I was correct on those last numbers that I showed you in the previous clips and slides, $457 billion as opposed to China's not given but lent 257 billion, but it then gave on a second loan to 75 billion. But again, who is appearing to be covering up China's, if the United States made a mistake, then who would also probably be doing the same thing. But because China made the mistake, or China put out and of course, you always hear about these fraudulent transactions, money laundering, stuff like that. Don't think that these there's actually the higher you go up on the ladder, the less chances people have of actually getting caught from things like this. So, for instance, if a person that's working at McDonald's, does a fraudulent tax return, they're going to be imprisoned, they're going to be fined, they're going to be having to pay buku bucks that they're not even making. They're going to actually send them, possibly take away everything that they can and send them possibly to prison for, tax fraud, and then expect them to also pay on top of that. Like, that's kind of idiotic. But get this, the person that's making, $500,000 or $2 million, $300 million a year can actually do the same thing, get a slap on the wrist, and not have to pay any fines. And then come back and do it again the next year, and the next year, and the next year, and the next year. While the whole time they're still making the same amount of money, not going to prison, not having to pay certain fines and fees. So from the 23rd to the 25th of October, 60 high-level public health and MERS practitioners, researchers, and experts met in Abu Dhabi to establish a pool of experts that can be deployed rapidly during any future outbreaks of MERS. Despite the substantial response to MERS by national health authorities, WHO and partners in all affected at-the-risk countries, the number of senior technically trained regional experts on MERS remains limited, while the need for such expertise has grown. With this 3-day workshop, WHO's regional office for Eastern Mediterranean aimed to expand the pool of MERS experts that can be deployed rapidly during the future outbreaks in the region globally. The progression of global response remaining challenges and the way forward. On September 26, 2018, back again before the coronavirus broke out in September 2017, FAO, OIE, and WHO brought together affected members, states, public health, and animal officials and academics to discuss what is known and unknown about the zoonotic origin of MERS, CoV. The recently published meeting report summarizes how focused efforts in activities and investments to address scientific and public health research questions accelerate promising medical interventions, and a more strategic on where activities are conducted globally will go further to address remaining public health unknowns. And just wanted to kind of throw this out there also. According to the Wall Street Journal, just looking up an old article here, here we see a COVID patient lying on a bed in a hospital somewhere. It says a visitor walked past a large photo depicting the 2003 SARS epidemic at an exhibit 40 years through the lens at the National Museum of China in Beijing, September 2018. China was criticized, get this, China was criticized for initially covering up SARS. Oh no, why would they cover up SARS? Did they not already cover up COVID-19? Oh wait, let's get that right. The timelines are backwards. SARS was covered up, MERS was covered up, oh, and coronavirus was also covered up, which was first detected in late 2002, but was disclosed only after it began spreading widely, eventually killing 774 people globally, according to the World Health Organization. Beijing overhauled the nation's disease control after reviews found that initial failures to contain the isolated patients with SARS allowed it to proliferate across densely populated southern China. Let's go back because there is some very in-depth wording that we really need to pay attention to. So again, let's go back. China was criticized for initially covering up SARS. Okay? Point 1. Covering up SARS, covering up MERS, and covering up coronavirus. Keep in mind, all three being a coronavirus type that is, again, found in the biological weapons facilities located in China. China doesn't just have one located in Wuhan, Hubei province, China, but there are several stretched across the continent of China. And so in late 2002, but it was only disclosed only after it had been spreading widely. So they knew about it before it was disclosed, okay? And guess who noticed it before it became widely spread? When there's an outbreak, WHO is supposed to be, World Health Organization, WHO, is supposed to be notified immediately and to pay attention to these things. If they're just sitting back on their, lazy boy sofas and just collecting money for donations from countries in the amounts of $457 billion and $250 billion, wouldn't you think that they would have some type of responsibility to notify countries and presidents, that there are early outbreaks? Their systems are flawed. Okay, they obviously don't work because they didn't notify us in time. This coronavirus had actually already been breaking out in China previous to December 31st. And when it was told to WHO organization, World Health Organization, it was actually disclosed to World Health Organization as a unknown virus. They had no idea where it came from. And then all of a sudden they make up things saying, oh, it came from bat soup. Well, they've been eating that bat soup, as disgusting as it sounds, for hundreds of years. And no one's ever had that problem. The thing is, it didn't come from a soup. It didn't come from animals. Because nobody else we've been eating a lot of animals stuff here all over the place. We've been eating chickens. Chickens are similar to bats. They can carry the same types of diseases. They can. Do they? No, not necessarily, but they can. But the thing is that this is not by any means a virus transmitted by the animals, because there's so many animals going around, and you don't hear people saying, oh, so-and-so got infected because a flock of pigeons flew over his head and crapped on his nose. Now he's got the coronavirus. No, you hear human-to-human transmission only. You do not hear about animals. So again, the World Health Organization, let's add that in there with our sentence, which was first detected in 2002, but was only disclosed only after it had began spreading widely, eventually killing 774 people globally. According to the World Health Organization, so again, according to the World Health Organization, Beijing overhauled the nation's disease control after reviews found that the initial failures to contain and isolate patients with SARS allowed it to proliferate across densely populated southern China. The Wuhan outbreak will test how much has changed. Great. We learned a bitter lesson in 2003, and we do not want that to happen again. So, we look at this. Where did the SARS outbreak come from? It came from China. What part of China? Let me see if I can zoom in here for you. Actually, I'll just highlight it. Do you see that? In Wuhan, China. The Wuhan outbreak will test how much has changed. And then it spreads from, so allows it to proliferate across densely populated southern China. The Wuhan outbreak will test how much has changed. We learned a bitter lesson in 2003, and we do not want that to happen again. Keep in mind, this article was written, a while ago, prior to the outbreak of our current coronavirus. So the SARS came from Wuhan. The Wuhan outbreak for SARS, keep in mind, Wuhan has a stage 4 biological weapons facility. Okay? Keep that in mind. Wuhan has a stage 4 biological weapons facility. Okay? Now that we got that down, let's move into today's recent outbreak. Coronavirus, COVID-19. Released from where? Wuhan, China. Hubei province, from a stage 4 biological weapons facility. Oh my gosh. How did we find that out? Well, just simply reading. That's all it takes, really, reading. Hong Kong's Department of Health, citing information from China's National Health Commission, said the cause of the cluster of pneumonia cases detected in Wuhan was still under investigation, but other known respiratory pathogens had been ruled out. The main clinical symptoms of those affected by the Wuhan outbreak are fever, with a few patients having difficulty breathing and invasive lesions on both lungs, which shows up on the chest radiographs, the WHO said on Sunday. It is unclear what the underlying source of the disease is, though the reported link to a wholesale fish and live animal market could indicate exposure linked to animals. The WHO said. Bats, for example, are known reservoirs for coronaviruses, and have been found to transmit the disease to humans through a third vector, such as a civet cat, as scientists found in the case of SARS. The pattern of unexplained pneumonia cases linked to the market selling seafood and live game strongly suggests, does not, pinpoint, but suggests that this novel microbe jumping from animal to human, said K.Y. Yuen, chair professor of infectious diseases at the University of Hong Kong's Faculty of Medicine. So again, it's only suggestions and opinions, and that was only a suggestion that came from K.Y. Yin, chair professor of infectious disease. So basically, who just goes to China and be like, hey, where did this virus come from? Oh, well, we suggest that it could have came from animals, but we're not really quite sure. And then who says, okay, well, just give us some type of opinion on what you think it could have been, and then we'll tell the rest of the world where we know it came from. Okay, so let's turn a possibility or a suggestion into a pinpointed, documented fact, and we'll just go along with that. Okay, great. So here they come. The WHO comes to the United States, tell the United States, oh, it came from bats. Great. This is a virus that's not supposed to be transmitted from animals to humans. But, I mean, have you eaten any bat soup recently? If you have, please comment down below, because I got some viewers that would be interested in to find out how it tastes. Do you add garlic or do you eat it with rice? Just wondering. Anyways, all jokes aside, this, again, did not come from a bat, and it came from a stage 4 biological weapons facility located in Wuhan, China. If this video was informative to you, please, again, make sure you drop a subscribe and share. Share. Subscribe and share. Subscribe and share. Thanks for watching. Until next time, The Last Viking TV is out. Have a great day and stay safe. Don't eat any bat soup. All right, and if you didn't believe me before, we're going to go ahead and jump right back into it. Epidemiologic clues to SARS origin in China. Abstract. An epidemic of severe acute respiratory syndrome, SARS, S-A-R-S, began in Foshan municipality, Guangdong province in China. And if you don't know, that is right next door to Wuhan, China, where they have a stage 4 biological weapons facility. In November 2002, we studied SARS case reports through April 30th, 2003, including data from case investigations and a case series analysis of index cases. A total of 1,454 clinically confirmed cases and 55 deaths occurred. The epidemic peak was in the first week of February 2003. Healthcare workers accounted for 24% of cases. Clinical signs and symptoms differed between children's 18 years and younger, actually from 18 years and older, persons 65 and older. These several observations support the hypothesis of a wild animal origin of SARS. Right, so they did the same cover-up with SARS that they did for the coronavirus. I mean, do you see the pattern here that China is consistently lying? They lied about SARS. It came from China. Actually, it came right next door to Wuhan, China, where there is a stage 4 biological weapons facility there. And they said the same thing about SARS, how it came from an animal. And they're saying the same thing about coronavirus in 2020 now, and saying that it came from an animal. So, yeah. Keyword SARS, pneumonia, community-acquired infections, disease outbreaks, zoonosis, China, communicable diseases, emerging child-aged. Again, so they're saying they came from an animal. I mean, have you been eating bat soup? Once again, if you have, please, again, leave your comments down below because, if you're eating bat soup, it could possibly give you coronavirus. But yeah, by all means, it doesn't come from like human to human. And it doesn't come from a biological weapons facility located in China. That's a stage 4, right? You got to keep in mind, China is a communist country, okay? Right now, we are officially receiving 30 to 60 days free trial of what it feels like to live in a communist country. Locked inside your doors, not allowed to go out, wear masks, those type of things. What China is trying to do and has been doing for quite some time, it failed before because the SARS, quickly went void because we were able to stop it. But what their hope was to eventually get multiple countries very, very sick and very, very panicked, and then have those countries spend trillions and trillions of dollars. Oh, but wait, isn't the U.S. already doing that? Adding to the national deficit, which makes us, if we keep doing this every month, it no longer makes us the power chain, the number one top country in the world. Now, who takes our spot? China. They take our spot. So, and they took it with only just a couple kamikaze agents that are from the Chinese militia, to go and spread this virus. Do you see how it works? Opinions all accepted. Please leave your comments down below and subscribe. Thanks for watching. Until next time, The Last Viking TV is out. Have a great day. Wait, hold on. On March 12, 2003, the World Health Organization, WHO, once again, issued a global alert about the case of atypical pneumonia in Guangdong province in Hong Kong Special Administrative Region, China, and in Vietnam. The disease, now known as severe acute respiratory syndrome, SARS is caused by coronavirus infections 2 and 3, and subsequently spread rapidly worldwide. The earliest identified cases of the disease occurred in Guangdong province in late 2002. But keep in mind, it happened in 2002, and the World Health Organization didn't bring it to the global alert until March 12, 2003. Do you see? Do you see how it all fell apart? Again, timeline. Again, write this down. Write this down. The earliest identified cases of the disease of SARS occurred in Guangdong province in late 2002. Now, let's say late 2002. Let's say November, December. Okay? So, let's say, for example, November. We have the month of November 1, December 2, and then we move into the next year, January 1, February 2, March 3. So we got about 5 months in between the time of the earliest outbreak until 5 months between the earliest outbreak until when World Health Organization issued a global alert about the cases of atypical pneumonia of Guangdong province and Hong Kong Special Administration Region. So, yeah. So it's about 5 months in between notifying the world about the global epidemic. The health organization definitely knew about the virus prior to telling the global, media about it. So if they did it once, they can do it again. Cover up, cover up, cover up. And again, then you got all the political crap going on with Nancy Pelosi and all the Democrats trying to make Trump look like he's the screwball, but in reality, it's Nancy Pelosi and the Democratic Party and the World Health Organization failing to notify other countries globally about this virus. So there you go. That's pretty much it in a nutshell. So anyways, please drop a subscribe and share. Thanks for watching. Until next time, The Last Viking TV is out.